We have a phenomenal speaker with us today. Her name is Sarah Dash, and she's a research fellow at the Georgetown University Health Policy Institute. I have a little bit of a funny story about Sarah. We actually grew up together dancing at the same ballet conservatory, and it was only by chance that she saw me speaking before a dance company performance in DC maybe last spring, that she found me. And it's been wonderful to reconnect with her. Sarah was a phenomenal dancer and extremely intelligent, and actually then chose to go to MIT, where she received a bachelor's in science, and then she went on to Yale, where she received a master's degree in the focus of public health. Sarah worked on Capitol Hill during the drafting of the Affordable Care Act legislation, and now she's studying the impact of the health insurance reforms on small businesses across the United States. We can't really ask for a better expert to be sharing her knowledge with us, because she both has a deep knowledge of what's going on with the Affordable Care Act, but she also really loves dance. So it's my pleasure to bring up Sarah Dash.
Well, thank you so much, Amy. Thank you so much to Dance USA, to Dance NYC. It is such a pleasure and privilege to be here today. And I'm just going to take this picture away. There we go. And thanks to all of you for coming. It's really such a privilege to be here. I mean, certainly both on a personal level, but I have some appreciation of what you all do every day, and I can't think of a profession that could benefit more from the Affordable Care Act. Dance is pretty much the most physically demanding profession I can think of, and of course dancers and as company administrators and so forth, you know, the health of the people in the companies is first and foremost to doing your jobs, and yet because of the way that the health insurance markets work in this country, or so far have not worked, really that has had a significant impact on people's access to health care in this industry. So it's a real pleasure to be here, and I'm going to focus on the coverage provisions here of the Affordable Care Act. So just to quickly say a couple of notes. The Georgetown Health Policy Institute and the Center on Health Insurance Reforms, where I am lucky to work, we do overview research and analysis of private health insurance reforms. We do monitoring of how states are implementing those reforms, because states are the primary regulators of health insurance, but also we have this huge new federal law. So we're looking at that and looking at how it affects consumers in terms of access to care and affordability and things like that. I do want to put in a little disclaimer, which is I'm not a benefits advisor or you know, that kind of thing. So we're kind of focused on the policy decisions and you know, trying to give you the best information you can, but you should consult your own benefits advisors or those kinds of folks for your own, you know, personal circumstance, and you have 2 fantastic breakout sessions after this. So quick overview of, I'm not doing too good, am I, Lucy? Okay, so just going to give a quick overview of the presentation here. I'm going to talk a little bit about Health Insurance 101, which I know everyone is super psyched about, and you're all about to like go running back to class or wherever you would rather be. But I think it's important to get a sense of what exactly is going on in terms of the health insurance market and where people get coverage now, where they might get it under the ACA. I'm going to talk about why the ACA was needed and how it expands coverage, particularly for individuals and small businesses, whether you're nonprofit or for-profit small business. Going to get into Medicaid, because that's another important aspect of coverage under this law, and try to get a focus on what you can do now. And I really want to hear your questions. We're going to have a long time, I think, for Q&A, which is great because, you know, as Brandon said, and Nathan, it's so important to get the perspective of how this thing is working on the ground, because best intentions sometimes don't always work out quite the way we want. So a little bit about health insurance. I had to put a chart, I'm sorry. But the main reason I wanted to put this up there is so people get a sense of where do people get insurance now, or pre-ACA, where do people get their health insurance? primarily you can see it's from this blue employer-sponsored coverage. About 18% have been uninsured, so that's about 50 million people that haven't had health insurance up to now, and then you have about 21% that get their coverage through Medicaid, which is a program for lower income individuals, and that 6%, that's a lot of what this law focuses on. That 6% who are in that non-group or individual market, who are getting coverage on their own, it's sort of the Wild West, and that's what the ACA really focuses on. So here's the two things you need to know about this chart, okay? The first one is that, as you are probably aware, it's a lot harder for small businesses to offer coverage to their employees. It's a lot harder because the rules are different, because they, up to now, could be discriminated against for all kinds of things, the occupation of the employees and so forth, and because it's a lot more expensive. They don't have the economies of scale of the bigger firms, which is the bar on the right. So the second thing to know is that coverage has been dropping across the board over the last decade. So, you know, you may have heard, and some of you may have experienced this yourselves, with employers dropping coverage, but that whole thing has needed to be shored up, and that's part of also what the ACA does. So for that reason, I'm going to focus here on individuals and small businesses, because that's really what the law focuses on. There are some provisions related to larger groups, but I'm going to focus on individuals and small businesses. Okay, so why did we need the Affordable Care Act in the first place? Well, accidents happen to the best of us, and that's so sad. And sorry for those of you that like never want to think about Nutcracker, at least not for 9 more months or so. But so prior to the Affordable Care Act, right, this poor guy probably would have been shut out of health insurance, denied coverage because we have had dysfunctional insurance markets. People up until January 1st could be denied coverage in the individual or non-group market because they had a pre-existing health condition. They could have their coverage retroactively canceled if they got coverage and then incurred a claim, had cancer or something like that. Health insurance companies could actually go in and look at those claims and then cancel their coverage. There have been serious problems with affordability. How many people think health insurance is too expensive? I do. Yeah, it's still too expensive, okay, and the ACA is going to help with that, but the affordability problems are the main problems why people don't have coverage. People have, particularly those who don't have it through their jobs, don't have any kind of employer subsidy, they don't have any other kind of subsidy to get coverage. In addition, health insurance companies have been allowed to charge more for people who have a pre-existing condition, any kind of health problem that they want. Gender, they have been allowed to charge women more than men. They've been allowed to charge older people much, much more than younger people, and the ACA limits that. And then in addition, if there have been adequacy problems too. So say you got insurance, great, you have that card, and now you go to use it, and then it's not covering the benefits that you need. You know, that's not very helpful. And everyone's been feeling the pain, whether you're trying to get coverage on your own, again, whether you're a small business trying to offer coverage, whether you're a bigger business, that's affected them too, the cost. And then also governments have had significant problems with healthcare costs. It's one of the biggest line items, and it leads to all kinds of deficits and budget battles. So leading up to the ACA, there was this real sense that something had to happen. We're on this Titanic, and it's headed towards something that's unsustainable, right? And we need to change it. So that being said, it's not the perfect solution. And so when we ask why the Affordable Care Act, you know, why is it this way and not another way? There's a lot of cooks in the kitchen. You're all creative artists, and so you know what the creative process can be like if not everybody's on the same page, right? And so to get this thing passed, you had to get 218 votes in the House of Representatives. You had to get 60 votes in the Senate. Now that this thing is being implemented, you have legislatures and governors and insurance commissioners and Medicaid directors in all 50 states and DC. And so, you know, sometimes people are on the same page, sometimes they're not, and so that leads to, you know, compromises, basically. I do want to say that to, I think, Brandon's point earlier, the other reason I wanted to put up this slide is that you all matter and your experiences matter. And so these people who, wrote the law and are implementing the law, and maybe after the elections there will be different people implementing the law, they want to hear from their constituents. And so it's really important for you all as constituents to speak up and to know who to reach when there's problems and issues. Because it really does make a difference. So, okay, enough of the problems. How does the ACA help to expand coverage? It helps to expand access to coverage, availability of coverage, first of all, through new rules of the road for health insurance. How many people think the health insurance system to date has been fair? Been fair? Okay. Think that it needed some changes? Okay. So, the first thing is that it bans denials due to pre-existing conditions. It bans rescissions or retroactive policy cancellations unless someone was outright fraudulent, okay? It opens up new doors to coverage that I'm going to talk about. It tries to make coverage more affordable. One, by, again, setting new rules on the way that coverage is. So I'm going to talk through some of those, but new rules of the road nationally. And this is a big deal because I know it's boring, but it's a big deal because for 100 years or more, people have been trying to change the system at the federal level, and it just has not worked. And so the Affordable Care Act is the first time that this has happened at the federal level. And that means that no matter what state you live in, there are going to be certain standards that health insurance has to meet. Even though it's going to be a little different from state to state, this is the first time there's been a national floor, okay? The other big affordability piece of this is financial help with health insurance premiums and then with the cost sharing that goes with health insurance. And then for the adequacy of coverage, there are some new standards for the benefits that have to be covered, for the way the plans are designed, so that once you do have that insurance card, it covers more of the things that you need. All right, what are the availability provisions? I mentioned some of the new rules of the road. The two ways that it opens the door to coverage the most are through these new health insurance marketplaces that I'm going to talk about, as well as through the Medicaid expansion. Does anyone get confused between Medicaid and Medicare? You even know what I'm talking about? Okay. Medicare is for people who are 65 and over, so like your grandma probably gets Medicare. Medicaid is generally has been a program for people with lower incomes, and the Affordable Care Act expands that in an important way. And then there have been some other coverage provisions. One of the most important probably to the dance community is this ability to stay on your parents' plan until the age of 26. Does anyone have anyone who's taken advantage of that or know anyone? Oh, good. Okay. Well, that's good because since that went into effect in 2010, there have been over 3 million young adults have newly received health insurance. So that's been a pretty big deal. And for those who aren't sure how to take advantage of that, there are resources out there, but that's been an important provision. And also, if anyone out there is under 26, your mom called me. She wants you to call her. Okay. So. On the affordability, okay, how does the Affordable Care Act make care more affordable? Come on. Let's get real. It's not fun to pay. It's not even fun to pay like a couple $100s a month for a product you might not even need to use, right? Even $150 a month. I'm sure we can all think of other things we'd rather be spending our money on. But that being said, it's an important and necessary consumer product, and the Affordable Care Act makes it mandatory, which I'm going to talk about in a little bit as well. So the law really does try to make coverage more affordable, and one way, as I mentioned, is through these new rules of the road. It ends the practice of charging higher premiums based on health status. So in the pre-ACA world last year, even if you got a policy, if you had any kind of problem, an allergy even, you admitted the horrible crime of taking allergy pills, you could be charged more for a health insurance policy. And then God forbid you had something really bad like pre-existing cancer or diabetes or something like that, you could be charged tens of thousands of dollars more. This ends, and it ended starting on January 1st. The law also bans lifetime and annual limits on health insurance. So before, there'd be health insurance policies that could be sold, and they had a cap on the amount of benefits that you could take advantage of. So for example, you had a really serious illness, but the benefits maxed out at $250,000 or $1 million. $1 million sounds like a lot until you have a really serious health problem. So the law also ends lifetime and annual dollar limits on health insurance policies. But importantly for consumers, it also limits out-of-pocket costs. So with health insurance, you're going to pay a monthly premium, and then every time you go to the doctor or use the healthcare system, there's going to be some cost sharing that's associated with that, some out-of-pocket costs. The law caps your out-of-pocket costs as a consumer, even while it lifts the limits on the health insurance policy itself. And then one affordability provision that's been in effect for a little while, and some of you might have experienced, is something known in Washington as the medical loss ratio. But what that basically means is that insurance companies have to spend at least 80% of their premium dollars on actual health care or quality improvements instead of their administrative costs or profits or things like that. And so if they don't do that, they have to issue a rebate. So I don't know if anyone has gotten a little check from their insurance company if they've had health insurance in the past couple of years, but the health insurance companies have been issuing those rebate checks if they didn't meet the minimum MLR requirement. I'm going to talk about the financial help for private insurance and Medicaid in a little bit, as well as the tax credits for small businesses. And I'm just going to keep putting in plugs for people who walk in that there are going to be 2 really good breakout sessions after this that are going to go into a lot of detail on exactly how you can get help. So I want to talk a little bit about the adequacy of coverage, because this is really important for consumers. So there are a couple of key features here. One is something called essential health benefits. So the law says that coverage now has to include 10 essential health benefits, and that's things like prescription drugs, doctor visits, hospital care, maternity, mental health and substance abuse, treatment, and other categories of care. And the reason this is important is that before, there would be a lot of policies sold, especially in that individual market, that Wild West, where it was like Swiss cheese coverage. Basically, you maybe could get a policy, but there's no prescription drugs, or there's no maternity. Or it covers really limited hospital care. There was even junk insurance that was sold where, it said it covered hospital care, but you could go out there and it covers hospital care starting on the 2nd day. That's not a whole lot of help if you end up in the hospital the first day and get a lot of tests done. So the law really standardizes that and sets a floor, although there are going to be some differences from state to state on the exact essential health benefits benchmark. And so the note here is to say that, some of your health insurance plan choices that you have available to you, they're not going to cover the exact same number of benefits, like 20 physical therapy visits all across the board. So something to pay attention to. The other provision in terms of adequacy is that preventive services also have to be covered without any additional cost sharing. So the idea here is that you want to be able to go and get things that keep you healthy and not have to pay extra out of pocket. So things like your flu shots, things like certain cancer screenings, mammograms, things like that, HIV tests, tobacco cessation, those proven preventive services now have to be covered at no additional cost to the policyholder. So what does this all amount to? I promise this is the last pie chart. Couple points about this, okay? This is if we had the ACA, if we have the ACA versus if we didn't have the ACA, and this is projections going up to 2019. So, pretty much what you can see is this orange, the employer-sponsored coverage stays pretty much the same. So, This is according to the Congressional Budget Office, which is the independent, voice on what's going to happen. And of course, they could be wrong, but this is sort of the best source that we have out there. So there's a lot of, talk about, employers are going to keep dropping coverage and it's a disaster. And, you can see here that it stays pretty much the same. We're talking about 23 million who are expected to get coverage through these new health insurance marketplaces, and then more people covered through Medicaid as well. All right, what else does it do? It's a lot more than coverage reforms, and you guys would kill me if I even tried to go into too much of this, but basically there's a lot there in the law that tries to deal with public health and prevention, that tries to deal with improving the quality of care that's delivered. How many people have had to get an x-ray once and then you go to another doctor and they don't have it and you have to duplicate a test and it's a pain. That's inefficient and that's bad quality, and then we're not getting what we pay for. So there's a lot of stuff in the law that really is trying to improve on the quality of care, as well as to contain the cost of care. There are a lot of provisions dealing with Medicare. So it was a really pretty comprehensive attempt to change the system. All right, but what does it not do? And that's my last little ballet reference here, but it's not a magic wand, okay? It doesn't fix everything all at once. It doesn't. But it's a step in the right direction. It's also not a government takeover. I hope, as you can see, it really builds on the current system. And health insurance isn't fun. It's probably not going to be fun. I would much rather come and see all of you guys perform. But it might make it easier. It might make it more affordable. It might make it less of a worry. So, okay. Here's the sort of the crux of how coverage gets expanded under the ACA. These new health insurance marketplaces and the Medicaid expansion. So here are the health insurance marketplaces. How many people have heard of healthcare.gov? Oh, good, okay. A bunch of you. That's good. So that is basically what the law said, is that the states could set up their own health insurance marketplace, which is a one-stop shop for getting coverage. And if they didn't, that the federal government would. So healthcare.gov is kind of the federal hub for coverage. And then you can just see these different logos. These are just a couple of examples, but the states that set up their own marketplaces, they have different branding and different names. So in New York, it's the New York State of Health. I think there's this guy named Billy Joel, and I'm pretty sure that's where they got the name here. Does anyone? No. All right. Nevada HealthLink, DC HealthLink. So there's some themes here. Minnesota, you guys are having your conference. It's called MNsure. So, and there's of course Connect in Kentucky. So obviously there are more states, and this is just a list of the states that decided for 2014 to establish their own health insurance exchange. If you're not sure. And by the way, I'm calling it a health insurance exchange because that's kind of what it was called at first, and then it got rebranded to be called a marketplace. So if I say exchange sometimes, if I slip into the old language, please forgive me. But it's supposed to be called a health insurance marketplace now. Anyway, if you're not sure which type your state has, don't worry, there is one in your state, but you can go to healthcare.gov, you can put in your state, and it will tell you which website to go to. So what are some of the basics in terms of what the marketplace really is? As I said before, it's a one-stop shop. So before, you might have had to go to one insurance company, Blue Cross, and then Cigna, and then another one, and fill out all the application forms and get denied or get a different rate, or maybe go through a broker to help you. Now the idea is you go in, you put in an application, you give them some basic information, and I'm talking about the individuals, but I'm gonna get to the small businesses too in a minute. You put in one application and you find out if you might be eligible for either free coverage under Medicaid or lower cost coverage, private brand name coverage through the sort of marketplace section. And then you get to pick plans and compare side by side. You're going to be able to compare based on premiums and cost sharing and maybe quality ratings and some other factors. So for small businesses, they also have their own own marketplace. It's called the Shop, and Eric from Small Business Majority is going to be talking about the shop marketplace. But the idea here is for the small businesses that want to offer coverage, it gives them a way to more easily compare options and get coverage to their employees. So what actually is available in the marketplace? And this basically shows that there's going to be different levels of coverage that are going to be available. So I don't know really why we think the precious metals is so creative, but that's the way the law was written. Bronze, silver, gold, and platinum. So basically what this shows, though, is that the bronze coverage is going to be a little less comprehensive. It's going to be covering, on average, about 60% of medical expenses, up to the platinum plan that's going to cover, on average, 90%. That doesn't mean for every single service, okay? This is on average for the whole plan. And for those of you who want to get technical, this is something called actuarial value. Now, the thing I want to say is that if anyone's considering a career transition, you should become an actuary because they make a lot of money figuring out stuff like this. I don't recommend it. Okay, so it may not be as much fun as being a dancer. But the point here is that if the bronze plan is covering, on average, less of your services, that means the premium's going to be lower. The premium's going to be lower, but your out-of-pocket cost sharing is going to be higher when you get that plan, as opposed to the platinum plan where the premium's probably going to be higher because it's more comprehensive, but the out-of-pocket cost sharing will be lower. So considering those things as you pick a plan is important. In addition, there's something called a catastrophic plan. That is available in general to people who are under 30 or who can't get other affordable coverage under the way the law is defined. But that doesn't cover as many services. It has a really high deductible. It covers only a limited number of doctor visits. So it is the least comprehensive coverage. And the tax credits that I'm about to talk about, they do not apply to the catastrophic plan. So it's not necessarily going to be cheaper than the others. Okay, so who gets to buy coverage? I've covered this pretty much, you've probably guessed. If you're on your own, you don't get coverage through your job, you don't have any other kind of source of coverage, and you want to go on the individual marketplace, that is who's eligible to go and shop. If you want to get the financial help that's available, there are certain income brackets for that financial help. For the shop, if you have basically 50 or fewer full-time employees, that is who can buy on the shop marketplaces, and that's going to expand in a couple of years, but for now it's up to 50, and there are ways of calculating how many full-time equivalent employees you have that Eric is going to talk about. So, I think. Now, if you're self-employed, if you're a sole proprietor, you would go to the individual marketplace. So that's just something to make a note of. And again, it doesn't matter if you're for-profit or non-profit or that kind of thing. For the tax credits, they can be up to 50% of the cost of providing coverage, and those are available only through the shop. Okay, so types of financial assistance, I've mentioned this. I think everybody is dying to know now. Okay, great. Well, who gets this financial assistance? What is it? Basically, there are things called premium tax credits. Sometimes they're called advanced premium tax credits. The idea here is that health insurance is too expensive. It's still too expensive, even with the more competitive, transparent, marketplace that's out there. And so, what the law did is it said that anyone who is making between 100% and 400% of the federal poverty level, so that's up to about almost $46,000 for an individual, would be eligible to get these tax credits. In addition, anyone who is making up to about $28,000 as an individual could be eligible for help with cost sharing. Which means help with those premiums, and not the premiums, help with the deductibles and the co-pays and so forth. And if you're like, oh my gosh, I can't even figure this out, the point is that you go to the marketplace and you enter some information and it helps you to calculate what kind of help you might get. So the thing to know about the tax credits is it's pretty unique. The law could have said, okay, everyone have $2,000 and go buy health insurance and we're done. And there were plenty of proposals out there like that. But instead what they said is, okay, we're gonna try to make this a little more progressive, a little fair. We're gonna cap the amount that people have to pay for health insurance based on a percentage of income. And it's gonna be on a sliding scale. So for example, someone making roughly $23,000, which is about 200% of the federal poverty level, that person's amount that they have to pay for their health insurance premium would be capped at about $120 a month. And so any plan that they pick that's more than that, their tax credit would cover some of the difference. So that's kind of generalizing it, but that's the idea, is that it caps people's liability for the premium that they have to pay. The value is linked to one of the silver plans that's on the exchange, so you can then get that tax credit and go shopping. You can either buy, a lower cost bronze plan or a higher cost gold or platinum. They get paid directly to the insurer, and they can get paid on a monthly basis. That's why it's advanceable. Or you can save it up and get it at the end of the year when you file your taxes. But it's really important that individuals have to report any changes in income to the marketplace throughout the year to avoid any kind of payback penalty when the taxes get filed in 2015. And so if you want more information about that, I think some of that's going to be covered in the session with the Actors Fund and Renata. So what is the cost sharing help? Just to talk a little bit about the cost sharing reductions, again, the idea is that if you're making up to about $28,000 as an individual, you get access to a plan that has lower deductibles and lower co-insurance and co-pays. How many people know these terms, by the way, or are they kind of, okay, good, like a good number, that's good. When I was a graduate student, I didn't understand how a deductible worked. I didn't understand how a co-pay worked. I didn't understand co-insurance really, and the problem is that if you don't understand it, then it can have a real financial impact on you. So it's always good to get a sense of it. But basically, these cost sharing reductions are gonna cap what people have to spend out of pocket. All right, a couple of notes about SHOP. The idea, again, is to compare plans a little more easily. This is where there is the biggest difference in terms of whether the federal government established a SHOP or whether the state established its own SHOP. The federal government has had a couple of delays. So for example, online enrollment isn't available, although it's available through other means, but it should be available in most states. There's also something neat called employee choice, which is the ability to, rather than sort of pick one plan to give to or to offer to employees, there is going to be the ability starting next year in all of the states to offer a range of plans that employees can then select from. And right now that's available in most of the states that have their own marketplace, but again, in the federal, it's been delayed somewhat. And it may not be working perfectly in all of the states yet either, but it's something to pay attention to in your own state. Again, for small businesses, there's a tax credit. It's primarily for the smallest, small businesses that have the lowest average annual wages in general. It's 25 or fewer full-time employees. But that can be also another source of help in affording coverage. Okay, so what's the timeline? We're in the middle of the open enrollment period. It ends March 31st. So anyone who is an individual, wants to get that coverage through the marketplace, has to get coverage and sign up by March 31st. And you also have to pay your premium to be officially enrolled. If we sign up by March 31st, your coverage would start May 1. And then there's going to be an annual enrollment period after this that'll be November 15th to January 15th. There are special enrollment periods if there are changes in your life. So similar to employer-sponsored coverage now, where if you don't enroll during the open enrollment period, but then you have a baby or get married or get a divorce or things like that would allow you to access a special open enrollment period. The first effective date of coverage was January 1st. That has now passed. And for small businesses, though, pretty much enrollment can be continuous or rolling basis throughout the year. So a couple of notes on Medicaid, and then I know you're dying for your stretch break, which I saw is on the agenda. So what's the big deal about Medicaid? Medicaid is a really, really important source of coverage for lower income individuals, and particularly, unfortunately, I think artists should make as much as pro football players, but they don't. So Medicaid is going to be a really important source of coverage potentially. What the Affordable Care Act does is it takes this program, which is currently in every state, but states can kind of set the income eligibility levels. And what it does is it says for anybody making up to 138% of the federal poverty level, which is translated to roughly $15,800 for a single individual, that person would then be eligible for Medicaid in their state. What happened when the Supreme Court ruled is that it basically became optional for the states to expand their Medicaid programs. So as a result, you have about half of the states that have expanded, and a little more than half that have expanded, and the others that haven't yet. So New York has expanded, but you're going to have to check your state and see if it has expanded. But this is going to be pretty important for single childless adults, which is most young dancers and company members. But basically what this slide shows is that there's going to be this coverage gap, unfortunately, in the states that haven't expanded Medicaid. And that's going to be a problem. And the reason why that's a problem is because, as I mentioned before, you might remember the premium tax credits go from 100 to 400% of poverty. But anyone who's making less than 100% of the poverty level, which is about $11,000, if those people aren't covered in their state's Medicaid program, they don't get any coverage. They really have no coverage option besides maybe what they were able to access before, which is just, they're uninsured, but they maybe can go to a free clinic or something like that. So that is also an area where folks in the arts community, if you're unhappy with that decision, that's where you go to your governor and your state legislatures. How's it going so far? You already got the picture. It's pretty mixed in the different states. So even though there's this federal floor, the states have a huge responsibility for implementing this, which means that it's not going to necessarily be the same in every state. So it's important to get educated on what's going on in your state. There have been certainly some bumps in the road, as folks have probably heard about, with the websites not always working right, crashing and things like that. But a lot of fixes have been made. A lot of that was to be expected. It's pretty complicated technologically to get all these things to work correctly. But really, enrollment is picking up. It has been picking up, picked up substantially in after Thanksgiving and in December. And then it will really pick up again. I just want to recap here. What do you need to know? Okay, if you're on your own, you need to know you have a responsibility to get coverage. There's this thing called the individual mandate, okay? So the ACA does all these things to make coverage more affordable, but it also imposes a responsibility on people to get coverage. And I'm sure there will be some questions about that. You basically have to sign up by March 31st to avoid that penalty. If you don't get covered, you have to pay a penalty in 2015, and that's going to be $95 or 1% of your income, whichever is greater. So you want to avoid that penalty. Just know how to access coverage. Again, go to healthcare.gov if you're not sure, and you can put in your state and get the website, and then click on all of their links to get started with coverage. You should know that there are probably other coverage options out there in your state, especially in the individual market or the small group market. But particularly for individuals, know that you're not going to be able to get those tax credits if you don't go to the marketplace, and they may not meet the minimum requirements of the law. Get a little bit of sense of what to look for in health insurance coverage, and I'm just going to touch on it because that's going to be addressed in the breakout session. So if you're a small company or small business, what do you need to know? You don't have a responsibility to offer coverage. If you have fewer than 50 full-time employees, you don't have to offer coverage now. You don't have to offer it ever. But if you want to and it's easier, you have this option of a shop marketplace that could make it easier to offer coverage. Know about the small business tax credits and how to access that. I didn't touch a lot on the bigger companies here because, again, the law is mostly focused on the individual and small group market, but there is an employer responsibility to offer coverage to employees if the company has more than 50 full-time equivalent employees. The administration delayed that requirement basically until 2015, but pretty much by January 1 of 2015, companies have to be prepared to offer coverage or to pay a penalty if someone is uninsured and goes to the marketplace and gets a tax subsidy. And it can't be just any coverage, it has to be minimum coverage that covers 60% of the healthcare costs and that it also is affordable to the employee. The shop marketplaces will be open to employers with up to 100 employees starting in 2016, and that'll happen in every state. States could have the choice to expand it before that, but I doubt that most of them will. Certainly there are other requirements. There's some reporting requirements and things like that that I haven't touched on today because I really wanted to focus on the coverage provisions, but just know that there are other requirements out there and it's important to take a look and to keep track of those. And I think Dance USA has some great resources on their website as well. What can you do? Explore your current coverage options. If you don't get it through work, find out, can you get the dependent coverage? Can you go to the marketplace? Like I said, you can go to healthcare.gov. And there are a lot of different ways to access that coverage. You can do it online, over the phone. There are wonderful people called navigators and application counselors. And one of them is sitting right here in this room, Renata, and she's going to lead the session for individuals after this. And those people are really there in the states to help provide more one-on-one kind of assistance to folks in getting enrolled. So just a couple, I'm going to wrap up with a few special considerations for the dance community. This really applies to any consumer, but especially for people who may be new to health insurance in the first place or have certain health needs, as the dance community probably does. Know what you're buying. It's really important to know. Are you on the marketplace, not the marketplace? If you have coverage now, how does that compare to what you could get on the marketplace? Know what the trade-offs are. Again, the lower premium, higher cost sharing issue. It all depends on an individual's financial situation and their level of risk that they're comfortable taking. But it's important to know that there's this trade-off. Knowing what the terminology is, as I said before. You all know the dance terminology backwards and forwards, but sadly there's this new terminology to learn as well. Carefully reviewing the benefits that are available in each plan, as I alluded to before, even though there's essential health benefits that are covered, it's not going to be the same scope of benefits that's covered in every benefit package. So, if there are particular health services that are important to you, really check out what's available. Know that there is something called a tobacco surcharge. I'm sure nobody smokes, and you're all quitting if you do, but if you smoke, there's something called tobacco surcharge. So I mentioned before, the health insurance premiums can't be higher if you have a pre-existing condition. However, the law did allow insurers to charge basically 50% more premium, 50% higher premium for someone who is a tobacco user. And some of the states have limited that or eliminated it, like New York has, but the thing to know about that surcharge is not only would your premium be higher, but then you also can't apply the tax credit to that portion of the premium. So it's kind of, could be pretty hefty. Understand the providers that are in the network, and then what the out-of-network benefits are, especially if you're traveling a lot, setting different pieces in different states and things like that. Out-of-network care often costs a lot more if it's even allowed. So trying to get a sense of that, and it's not always easy to figure it out, but you can try to know that that's something to look for. And then the last real piece is estimating your income and reporting income changes on the individual marketplace is definitely an important consideration, especially for folks who may be working multiple job opportunities, and it's hard to estimate income. So I'm going to stop, and I think we have some time for questions and answers, and I'm going to just depend on folks to tell me when the session is over. So that's a great question. So if you are a nonprofit, basically you can still be eligible for that small business tax credit, but in 2014, rather than covering, assuming like you meet all the other requirements of having fewer than 25 employees and, the average annual wages being under the cap, the tax credit would be up to 35% of the premium that you offer, as opposed to 50% for the for-profits, and that's just because presumably you're already getting a tax benefit as a nonprofit, but you can still be eligible for that tax credit. Thank you for that question. So let me try to clarify. So the way the law works is, I've described it as, it sounds kind of cheesy, but it's a little bit like a layer cake, right? And this is just, unfortunately, this is the way lawmakers all the time think about these kinds of programs, is they're income-based. So for individuals who are making less than about $11,500, that's 100% of what's known as the federal poverty level. Those individuals do not have access to the premium tax credits in the exchanges, because the idea was that those people would be getting Medicaid. But in a lot of the states, single childless adults are not eligible for Medicaid, because that's just the decision that the state made. So for example, there are some states where someone needs to be making like 38% of the federal poverty level to be eligible for Medicaid. So anyone between, say, whatever that state's cutoff is and the 100%, not only do they not get Medicaid in that state if that state doesn't expand Medicaid, but then they also don't get the premium tax credits. And again, the way the law was written, it was supposed to cover everybody because they were supposed to get Medicaid, but then the Supreme Court decision came down and made it optional for the states. So there is this weird little overlap, because Medicaid goes up to 138% of poverty for those states that did expand it, which is, again, roughly $15,800 for an individual. So anyone between $11,000 and $15,800, that little overlap, if the state did not expand Medicaid, but there's still a marketplace in that state, those people could get the premium tax credits through the exchange. But this is kind of an important distinction, but if a state does have its own marketplace and it expanded Medicaid, then the people who get the premium tax credits will be the ones who are making over the 138% of poverty, so over the $15,800. So, people's individual circumstances are going to change. There's this thing called, I hate this word, but the health policy community talks about it as churning. So people who might be eligible for Medicaid, but then their income goes a little higher, and so then they're eligible for the tax credits. And that means that, say your income is fluctuating between, that $15,000 range and 17, 18, 19, 20, people could be eligible for different coverage depending on their income changes. And so it is a big problem. It's a big policy problem that's recognized. And, states may have different options to try to address it. And I think it's something that they're looking at, but it's definitely not a problem that's been solved yet, because obviously that could disrupt someone's care. There was one point I wanted to make that's pretty specific to this community, which is on the individual mandate and the requirement to have coverage, which is that workers' comp does not count as minimum essential coverage. So you may have already known this, but for those who have workers' comp, for injuries on the job, that does not count as health insurance under the law. So folks would still need to get the minimum coverage under the law. That's a great question. So the question was about enforcement of the individual mandate. And as the gentleman said, this is enforced by the agency we all know and love, the IRS. because they're tax credits. So how it's going to be enforced, I mean, I can't predict into the future in terms of the enforcement, because as we've seen, there have been some decisions along the way to delay certain things. That being said, delaying enforcement of the individual mandate would have some challenges just from a policy standpoint. The reason for it is because of that provision I mentioned earlier with insurance companies not being allowed to deny coverage due to pre-existing conditions. That's a great provision, but you have to have an individual requirement to buy coverage to make that work, because otherwise it would be like, you buy insurance after your house is already on fire kind of thing. So the idea is that if everyone can get into the risk pool, sick, healthy, younger, older, et cetera, then the insurance companies can offer coverage to anybody who comes. If you don't have that individual mandate, then basically the idea is that people who know they have a health problem or are going to need health care, they're the ones that are going to buy coverage, and other people are going to stay out of the pool. So, I can't really speak to how the IRS is going to enforce this in 2015, when tax time comes for everybody. But it's a pretty central linchpin policy-wise of the whole law. And for those who have been following, I mean, that's why there have also been attempts to delay it or get rid of it, because those who are not in favor of the Affordable Care Act, they know that if you got rid of that, you kind of get rid of the whole thing. You get rid of all those consumer protections and market reforms, et cetera. Any other questions? All right, I think we have stunned everybody into silence. So thank you so much, and go to the breakouts.